Hi guys, welcome to Plastic Surgeon Vlog. In this video we will discuss about the CT scan. So C in the CT scan stands for computerized and T for the tomography. So basically it's a use of computer and the X-ray together to generate the high definition image of your body. So if we see the conventional X-rays, they are not providing that much detail. But if we are using CT scan, so by the help of the computer and the radiation, we are generating some kind of images which are much better than the your conventional X-ray. And this way, CT scan is far superior. So by CT scan, we can see inside the body, like we are cutting your body in the slices. See how CT scan works. Okay, so you all must have seen the CT machine. So it's a cylinder kind of thing in which we move the patient body. So suppose this is my body and this is the problematic area. This is the tumorous area I have to scan. So now this is the tumor. Okay, now I want to see how deep is this tumor is inside the body, because I have to do resection. If I'm cutting it and suppose some tumor is remaining here, so the tumor will reoccur. So now what I have to do, I have to see how much deep this tumor is infiltrated, because from the outside I cannot see. So now I'll go for the CT scan, right? So what we'll do, suppose this is my head, this is my abdomen where I'm having tumor, and this is my legs. So I have to do CT scan of the abdomen. So what I'll do, I'll put my body in the CT scanner. So here is a tray or a table. So on this table usually patient lies, and in this manner it moves inside the CT scanner or the cylindrical tube. Now this scanner will rotate and take multiple images of my abdomen. In this case my full body is moving inside this scanner, but radiation I am getting over the abdomen only. No, I am not getting radiation on the my head or the legs. I am getting focused radiation on the abdomen, and I'll take and the machine will rotate like this. Machine is rotating, but my body will remain static. So by rotating the machine, will take three-dimensional images of this tumor, right? It's like slicing your body. So ultimately what I'll get images like this. Suppose somebody have sliced my body. It's like, I'm giving you this example, don't be afraid. So finally it's like getting the slices. So these are known as CT cuts. So when I'll see the picture, I will see these kind of slices, and by seeing the slices I can see how much deep tumor has infiltrated my body. Okay, so there will be multiple slices. I can get 4 slices, I can get 10 slices, I can get 100 slices also. So 100 slices is known as thin cuts, in which radiation exposure is more. Normally we'll take around 4 mm of the slices, like the thickness of the slices is 4 mm. But if we need fine detail, we may go for the 1 mm slices also, that we do in the facial skeletal. So it's like seeing my body in the slices. Somebody have cut my body in the slices without actually cutting my body. So in this manner CT scan works. Now with reference to each body part, there are variety of the CT scan. Like there is CT scan of your brain, there is CT scan of your face or the skull bone or the facial bones, then CT scan of the chest, CT scan of the abdomen, and certain other special investigation like the kidney, urinary bladder CT scan, and your CT angiography also, which we'll discuss later. Well, basically if we see CT scan, so broadly there are of 2 types. One is plain CT scan, in which we are just using X-ray and the computer to generate the images. But other variety is known as contrast enhanced CT scan, which is stand for CECT. So in CECT we will give you some kind of contrast agent, or it's a liquid or a dye. So you can take this dye in 2 ways. Either you can drink it, which is oral contrast, or we can give by the injection in your vein. So by giving this dye or the contrast in your body, your blood vessels will enhance in the CT scan, and we can get more better definition of your blood vessels and other structures. So this is contrast enhanced CT scan. Another one is plain CT scan. Now there are certain things you have to remember when you are going for the CT scan. First thing, don't use any kind of metal. Anyways, this is more important precaution when you are going for the MRI. But in the CT scan also, you need not to wear any kind of metal, like earrings, like nose rings, like ring in the hand, like bangles, like the necklace, because they will produce certain kind of artifact, although they are not dangerous like they are dangerous in the MRI, but yeah, they will produce distortion of your CT images. So better to just remove all these things before going for the CT scan examination. Second point, if you are pregnant, don't go for the CT scan, because CT scan X-ray beam can cause like adverse effect to your fetus. So tell your doctor if you are pregnant, and don't go for the CT scan. Greatest danger is in your first trimester, because at the time all organs are forming, and if you are putting radiation at that time, so your fetus will be at risk. Third point you have to remember is, if you are allergic to certain kind of drug, certain kind of medication, or certain kind of dye, then you have to tell your doctor before it, because sometimes we put dye inside your body, or we will give certain kind of injection to you, so that injection can cause allergic reaction, which may range from very minor itching to like severe anaphylaxis and the breathing difficulty and on the cardiac arrest, but that is very rare, but you have to keep this in mind. Fourth point you have to remember is, if you are having certain kind of implant in your body, like if you have cardiac implant, pacemaker, if you have hearing implant like hearing aid, or other kind of clips or vascular devices inside your body implanted before or some previous your surgery, so you have to tell your doctor about this, because although in the CT scan they are not as such damaging to your body, but yeah, they may produce certain kind of artifact which will distort the CT images. So you have to tell your doctor about the previous surgeries or the implants. Fifth point we have to remember is, if you are a claustrophobic means you have fear of the closed spaces, like you are in the lift, you are having fear. If you in a closed room, you develop some kind of panic reaction. So you have to tell your doctor if you are claustrophobic, because have you seen CT scan is there is a cylinder in which your body moves in. So some patient develop claustrophobia, although it's like CT scan takes 5 minutes to 10 minutes to complete, while MRI takes 30 minutes to 45 minutes to complete. So claustrophobic patients tolerate CT better than the MRI, because they remain in the tube for just 5 minutes or the 10 minutes. So, but this is important, you have to tell your doctor before that you are claustrophobic. Sixth point you have to remember is, if you having kidney disease, you have to tell your doctor, because if your creatinine level is high means if it is more than 1.5, in that case we cannot give you dye, and sometimes giving you dyes become very essential to give better pictures or to give the better detail. And to give dye, we have to know your creatinine level, how much is your creatinine level. Although if we are going for the plain CT without contrast, so in the kidney patients we can go ahead, but if you are having kidney disease, you have raised creatinine level, then you have to tell your doctor about it. In that case he will take certain precaution, like giving you more fluid and giving you certain kind of injection which is known as acetylcysteine, which we are not going to discuss here in detail. Now we all know that there is exposure of the radiation. So is there chances of cancer? Well, there is too much debate over this topic. If we see a conventional chest X-ray, so that involve a dose of 0.10 radiation. This dose is known as millisievert, but I am using it 0.10 only. So this involves 0.10 dose of radiation, while a CT scan involves a radiation dose of 15 to 45 to 50 units. So that depends upon which body part is going to be scanned. Like abdominal CT involves only 15 to 20, while the brain CT scan involve up to 50 millisievert or the units of the radiation. So one X-ray is equal to approximately 150 one CT scan is equal to approximately 150 X-rays or sometimes 400 X-rays. So is there in chances of the radiation exposure and the development of cancer? Well, answer is yes, there is chances of development of cancer. National Advisory Committee on the Cancer Development in the United States has conducted a study over a period of 20 years, and they have like millions of patients underwent CT scan, and over a period of 20 years they just followed these patients up, and they noticed that rate of development of cancer by the CT scan exposure or the CT scan is just 1 in 2000. Means if there is 10,000 patients are going for the CT scan, so 5 out of these 10,000 may develop. This is not sure, but yeah, they may develop cancers. But believe me guys, this risk is very low. If you consider the natural exposure of the radiation to our body, like we are getting radiation from the outer space, so it is around 2.5 millisievert a year. So that also can cause cancer, and sometimes CT scan becomes so indispensable then we have to go. So if you see, the calculated risk of 1 in 2000 is not that much high with the benefit we are getting with the CT scan. So question comes, what are the benefit of the CT scan? So if you are, sir, in some cases CT scan is the rule, we have to go for the CT scan. Like if you are a cancer patient and we have to stage your disease, like it's a stage 1, 2, 3, 4, in that case CT scan is far superior than any other modality. Sometimes in the facial bones we prefer CT scan over MRI. Sometimes in the limbs we prefer CT scan over MRI. But in some cases MRI is preferred. That depends upon what is your status, what is the disease status. So if you are a cancer patient, then CT scan is mandatory. Second thing, sensitivity of CT scan in detecting the lesion or the tumor is very high. So suppose if I'm having tumor in my lung and if I'm going for the X-ray and the tumor size is 1 centimeter or less than 1 centimeter, so X-ray will not be able to detect the tumor. But CT scan is having sensitivity that it can detect a tumor size of 1 centimeter or less than 1 centimeter. So in that case CT scan is far superior than the X-ray. So this is all about the CT scan, and I hope you like this video. If you like this video, just subscribe to this channel, and in case you have any query you can put in the comment section, or we can have chat over the Facebook Messenger or the Instagram. So thanks for watching. Have a nice day. Bye bye.